Well, we now have three different genetic tests to help us make the decision about which prostate cancers warrant treatment versus those that we can safely follow. There's the Prolaris test that looks at genes in the cell cycle progression pathway. There's the Genomic Health Oncotype GPS test that looks at 5 different family of genes in both the cancer and the stroma surrounding the cancer. And there's the Decipher genomic classifier test. Now, each of these tests actually looks at a slightly different endpoint. In the case of Prolaris, it looks at 10-year survival from prostate cancer. In the case of the Oncotype GPS, it looks at the probability that a man whose biopsy shows only Gleason 6 or 3+4 disease actually harbors significantly more pattern 4 or 5 and or were he to have a radical prostatectomy would have adverse pathological findings. And the Decipher test looks at a man's 5-year probability of developing metastatic disease. Now, which test to use in which setting and in which patient is really not known. There was a study published very recently in European Urology where each of these 3 tests was measured on each of about 5 different cancers that were present in 4 men's prostates, and there were discordant results showing that each man harbors many heterogeneous cancers and that one genetic profile may be somewhat reassuring, whereas another one may raise the possibility that it's quite aggressive. So in the setting of where we have now, I don't think anybody could say categorically which of the tests is ideal. And it's another one of those areas in prostate cancer where it's up to the patient and the physician to make shared decision making.